Hi all, welcome to my first vlog, Skills and Capacities in the Weight Room. Just quickly, before we get stuck in, to differentiate between a skills issue versus a capacity issue. A skills issue is very often a motor control issue or an athlete's experience or lack of experience with a particular movement. So often proper coaching can correct a skills issue. On the other hand, a capacity issue is very oftentimes a mobility issue and can also sometimes be a force production issue. So as a result, coaching doesn't necessarily rectify the movement. However, exercises and drills and stretching can correct it. We will be reviewing a barbell back squat and a barbell overhead press, and due to COVID-19 restrictions, both athletes will be using a broom in their own homes to demonstrate for us. Okay, our first athlete, Ed, is not particularly experienced in the weights room or with squats. We're able to see it's not a bad first attempt, but we're able to see a hip shift pretty evidently on his left side there, and a lack of depth as well. Now the back view is more helpful for us here. We're able to see the hip and pelvis shift to his left side, which then creates the external rotation of the right hip, which we can see here as well. This athlete's dominant leg is his left leg. So when he's playing football, he describes himself as all left peg. So it's often the case that the technique will look like this because the right glute is not firing. It might be a lack of lower limb musculature on that right side, or simply that the coordination isn't quite there. The first way we're going to address the right glute not firing is a double leg bridge. Now I'm wanting the athlete to feel both of his glute meads turn on, focusing on purposeful coordination, which is why it's not a single leg bridge. Great, and so once the coordination problems are rectified, we're going to transfer the stability work into something more functional for this athlete. So we're looking here at reactive training, which is helping the body learn how to fix the problems it's facing by teaching it what it's doing wrong, essentially. So what the coach here is doing is pulling the knee and the quad, just the lower limb, into the wrong position for the athlete to counteract it. Given the athlete's inexperience when it comes to squats, and particularly weighted squats, I thought it would be helpful to strip things back and undertake some body weight sitting squats using a chair and of course a bench if you're in the gym, which will have some greater depth to it. This required the athlete in this instance to readjust his pelvis position, to make even contact with the bench and just be very conscious of that bench or of the chair in this instance, while also considering his squat depth. Okay, and so finally we're going to go back into the squat now that the athlete has learnt a couple of added elements. He has a band around the just above the knee joint for him to consciously be assessing the coordination. Now that's the tension across both hips, making sure that that's even, and also making sure that his glutes are activated. So that's really the purpose of the band. We can see here from this angle the improvement, which is fantastic to see. And there are a few other niggles, but I think with time, with practice, they will iron out. Okay, with our second athlete, and we'll be looking here at a capacity issue, we can see immediately that there's a lack of depth. With the athlete noticeably above parallel, we can see where the athlete's movement is restricted. So she achieves maximum dorsiflexion through the ankle really early, and then there's this continued forward lean and exaggerated hip flexion in an attempt to achieve a greater depth. Comparison is best made using figure 18 of Meyer et al. 2014, where we can see appropriate depth, and by observing the apex of depth position from the lateral perspective, we're able to see the athlete's tops of thighs and femurs are well above parallel to the ground. Confirm that this is in fact a capacity problem regarding dorsiflexion. We've undertaken a functional test here of the athlete's right ankle and left ankle. The right ankle measures only 3 centimeters when undertaking the knee to wall test. The athlete has previously torn ligaments in this ankle. The left ankle is not a great deal better. It does measure about 6 centimeters, so there's a little bit more give on that side. Improving ankle mobility is going to look pretty similar to assessing ankle mobility. For increasing range of motion, it's best to start on soft tissue mobility first and then follow it up with joint mobility work, which is what you're seeing here with the isolated gastrocnemius and soleus stretches. Stanek, Sullivan and Davis 2018 and Young et al 2013 both find static stretching and soft tissue massage are the most efficacious, research-backed and easiest to perform exercises. Spending a couple of minutes on each of the following 3 ankle mobility exercises is a great way to warm up for squats or really any lower body workouts. And here, putting a plate at the forefoot means that it starts the foot in a relatively more dorsiflexed position, so that when the athlete descends, she hits that barrier faster, and the goal is to continually drive into that barrier. And in the final exercise, we see the exact opposite. So typically you see athletes with poor ankle mobility squatting with their heels on a plate, which you'll see here. Placing the weight in this position is an extremely effective way to force the ankle into a newly gained range of motion. This puts an athlete's ankle into more of a plantar flexion, so it allows the athlete to go into more dorsiflexion excursion and therefore a deeper squat, as we're seeing here. So we can really see that the femur is starting to look slightly more parallel to the floor, as we were hoping for earlier. It's not a perfect squat by any means, but more exercises to improve ankle mobility, specifically ankle dorsiflexion, will go a long way. Now on to our second exercise, which is the overhead barbell press. The first athlete is experiencing a skills issue related to a lack of experience and familiarity in a weights room, first and foremost. We can see the placement of the athlete's hands is too wide. That's the first thing. The second thing is that at the top of his shoulder press, you can see that the hands aren't in line. The athlete is favouring his dominant side, which is his right side, and then that results in excessive wrist extension through that left wrist that we can see there. On the way up and down, the elbows also flare out at right angles. We can also see that when the athlete presses that bar over his head, it's still in front of his body, so it isn't balanced over his shoulders and his mid-foot. He has locked his elbows out at the top. I think it's just a lack of experience with this movement. The good news is when undertaking a shoulder mobility test, we can see that he's got no issues there. So locking his arms out above his head should be possible. It's just about getting the right coaching cues. Now, we can already see some improvement just with some pretty simple coaching cues and giving him an understanding as to what the exercise is meant to achieve. So the coaching cues provided to him were to keep his hands a little more narrow, so closer to his shoulders, get those elbows tracking forward and under the bar as well. And finally, we can see from the side view that the athlete's shoulders are achieving full flexion. So the bar is up and over the body, the midfoot as it's meant to be. There is still a way to go, but it is drastically improved. So with our second athlete here, we're going to demonstrate a capacity issue. There are a couple of skills issues as well. I won't go into those. The capacity issue that we are seeing here is very likely due to lack of shoulder mobility or range of motion. We get a better understanding of this from the lateral plane side view. So we can see here that the shoulder is not achieving full flexion. If we're taking normal range of active movement of a shoulder to be specified at 180 degrees for flexion, we can see here that there is a deficit in this athlete. What I've advised for this athlete is to undertake some exercises to focus on the shoulder joint and enable it to move through its full range of motion. Each of these exercises also go a ways to strengthening and stretching the anterior deltoids, pec muscles, and the top of biceps as well, which are all imperative when it comes to shoulder flexion. Okay, so after those exercises, the athlete is back into an overhead press. We're able to see that she can achieve closer to full flexion, which is great. So if we just compare it to previously, we can see a noticeable difference. Despite the improvement of shoulder flexion, there is also a compensation with arching of the spine. So this compromises the neutral position with some coaching cues that will improve the skills-based issues.